Hello, thanks for listening in, and thank you to the Donkey Breed Society Eastern Region for asking me to talk about teeth, and most of what I say also applies to horses, mules and zebras. Now I make no apology for making a large part of this talk an anatomy lesson, because it's only by understanding the unique anatomy of an equid tooth and its life history, so different from our teeth, that we can appreciate the importance of lifelong professional care. No talk on donkey teeth would be complete without mentioning elephants, who in my view have the perfect tooth design, so watch out for that later. We'll see what can go wrong and what you can do to minimize problems. Losing a tooth in a human may be an inconvenience or a cosmetic embarrassment, but it's not life-threatening. Losing a tooth in a donkey very well could be. As we'll see, the condition of the teeth in donkeys can literally mean the difference between life and death. And just so you know, I'm going to show you pictures of skulls and one or two pictures of dental pathology. Just try chewing a blade of straw and see if you can reduce it to tiny fragments, as a donkey has to do. And here's a question for you. How many times a day does a donkey chew? 500, 50,000 or 5,000? We'll find the answer later. So let's have a look at the teeth. The front teeth are called incisors, and all equids have 6 in the top jaw and 6 in the lower jaw. These incisors are used to cut the vegetation, such as grass, but are also essential for both self and mutual grooming. As you know, we can guesstimate the age of a donkey by looking at the horizontal surface of these teeth, and this is also called the occlusal surface. Some donkeys have a pair of vestigial teeth called wolf teeth. They serve no function in eating or fighting, but may have been useful millions of years ago when the donkey ancestor ate a very different diet. In another million years or so, they may no longer exist, as evolution usually gets rid of anything that serves no function. They rarely cause any problems in donkeys, but they can be removed if your dental professional advises. Some donkeys, both male and female, have canine teeth, and their function is as weapons of war rather than chewing. Most male horses have canine teeth, but only about 20% of horse mares. We humans all have canine teeth, but I hope we don't all use them for fighting. Donkeys have 6 cheek teeth in each lower and upper jaw. The first 3 are called premolars, and the back 3 are called molars. Their function is to act as a single grinding unit on each side, reducing long fibers to fragments around 2 to 3 millimeters long. Think of a mill that grinds wheat grains into a fine flour. For a grinding machine to work, there has to be intimate contact over the whole grinding surface. So if a molar is missing, the grinding unit becomes hugely less efficient. Just bear in mind that your donkey will take in long fibers of straw, maybe a foot long or more, and he needs to reduce those to tiny 2 to 3 millimeter fragments. There's a convention for numbering teeth, and it's the same in human dentistry. If you split the donkey's head down the middle, then we can describe 4 quadrants of the mouth, which we call arcades. They are numbered as in the diagram, so the first arcade is the top right jaw, and arcade number 2 is the top left, and so on. And the teeth are numbered too, so tooth 101 is the first incisor in the first arcade, and tooth 411 is the 11th tooth in the 4th arcade. You'll see that the canine tooth are number 4 in each arcade, and the wolf teeth are number 5. Even if they're not present, the numbering remains the same, so the first molar in each arcade is always number 6. Hopefully this will help you understand a dental chart if your dental professional leaves you one, and they certainly should. And here is a typical dental chart which your dental professional should give you. It's your record of what procedures were done and any recommendations of how long should elapse before the next examination. And it's really essential if you happen to move to a new vet practice or use a new dental technician. Have a look at this at your leisure, as there's a lot of information on it. And please be very suspicious of any person who doesn't provide you with a copy of the chart. How do you know what they've done? You can't actually see what they're doing very easily. The diagram on the left is a human molar tooth, and it's called a brachydont or short crown tooth. The one in the middle is an equine tooth, and this is called hypsodont, meaning long crown. These diagrams are not to scale. The human molar is about 2 centimeters in length, the donkey's around 11 centimeters. That's longer than a king-size cigarette. It's really important to grasp that this is the final size of the tooth. It doesn't grow any bigger from the bottom as it wears away at the top. In fact, it becomes smaller. The red area is the gum, so you can see that all the crown of a human tooth is above the gum line. This tooth has to last us a lifetime. It doesn't grow at all. In contrast, nearly all the crown of a donkey tooth is below the gum, within the jawbone. The bit above the gum is called the clinical crown, and the bit below is called the reserve crown. And that's exactly what it is. Crown held in reserve for when the clinical crown gets worn away by eating abrasive food for 16 to 18 hours every day. This 11 centimeter long tooth doesn't grow but erupts. That is, it moves upwards out of the lower jawbone and downwards out of the upper jaw at the same rate as the clinical crown is worn away, around 2 to 3 millimeters a year. Of course, it's very variable, but you can work out from these figures that an 11 centimeter long tooth will only last a donkey around 33 years if it's worn away at a rate of 3 millimeters a year. You can also see that the 3 tissues that make up the equine tooth, cementum, dentine and enamel, are in layers, which accounts for their complex appearance on the occlusal surface of the tooth, as in the picture on the bottom right. These 3 tissues differ in how hard they are, and this explains the undulating, ridged chewing surface of the tooth, as all 3 tissues wear away at a different rate. Enamel, dentine and cementum are all harder than bone, and this has implications that we'll talk about later. Top right is an elephant's molar and is around 24 centimeters from front to back and weighs around 2 kilograms. An elephant has just 4 molars, 1 in each upper and lower jaw, and you'll see why I mention this when we talk about dental problems in the donkey. This video shows how the teeth gradually erupt over the years. Now, the tooth root area doesn't contain enamel, so the chewing or occlusal surface will lack the enamel ridges of the younger tooth that makes it such an efficient grinding surface. The tooth becomes smooth and no longer functions to grind the food. An old donkey with molars like this is said to be smooth-mouthed. The X-ray of a young equid on the left illustrates just how much space the teeth take up in the head. In fact, they account for a significant proportion of the skull's weight. The diagram in the middle shows that the back molar is below the level of the eye, and the skull on the right has some areas of bone cut away to show that the tooth roots of the molars actually live within the sinuses. These are air-filled cavities within the skull which serve to lighten it. The pictures at the top right indicate where the various sinuses are in relation to the outside of the head. You can see from the skull that the lower cheek teeth in this young donkey are really close to the margin of the lower jawbone. In young donkeys, there's an awful lot of tooth present, around 11 centimetres, as they haven't worn much clinical crown yet, so little eruption has occurred. But remember, these teeth are going to get shorter and shorter as they wear away from the top. The bumpy feeling of the lower jaw margin in a young donkey is caused by prominences of the bone necessary to accommodate those tooth roots. These are called eruption bumps. As eruption occurs, the jawbone gradually remodels and the lower jaw margin becomes smooth. Can you also see from the skull that the premolars are angled backwards, but the molars are angled forwards? The end result of this is that the clinical crowns, those areas of tooth above the gum line, are pushed together, so there are no spaces between each tooth. Or at least that's how it should be, but more of that later. And the donkey has a sturdier lower jaw than the horse, probably because of the strength needed to tackle the highly fibrous food he's designed to eat. Donkeys chew in a very different way to humans. In donkeys, the upper and lower jaws are anisognathic, or unequal, the lower jaw being narrower than the upper jaw by about 30%. At rest, about a third of the chewing or occlusal surface of the upper teeth is in contact with about a half of the occlusal surface of the lower teeth. If a donkey just chewed up and down, the upper and lower teeth would only make partial contact. You can also see that the occlusal surface is not horizontal, but angled at about 15 degrees. All this anatomy means that the donkey has to chew sideways and only on one side at a time. The end result of this is that wear of the occlusal surface is not uniform across the whole tooth, so sharp points can be the result on the outer edge of the upper teeth and the inner edge of the lower teeth. I hope this explains that what we call focal overgrowths, those sharp points that the dental professional will remove, are not overgrowths at all, but actually the result of underwear. Remember, the whole tooth is erupting all the time in response to wear caused by chewing, so any areas that aren't worn down will be at a higher level than the rest of the tooth surface. And bearing in mind that the normal eruption rate is around 2 to 3 millimeters a year, it doesn't take many years before the underworn areas, which we do call focal overgrowths or sharp enamel points, can be really long and really sharp. More of those later. Like us, donkeys have two sets of teeth, baby or deciduous ones and adult ones. The newborn foal may already have cheek teeth at birth, and the first two incisors are seen within about the first week, so a foal can nibble vegetation while he's still sucking his mum. The picture on the right is a 10-day-old foal. The other incisors are usually all present by the time the foal is 6 months old, so he has 12 incisors and 12 premolars. The reason he doesn't have baby molars is that the head is simply not big enough. If wolf teeth are present, they will erupt at about 9 months. All the permanent teeth are present by the time the donkey is 5, and canines, if present, will erupt at this time too. Aging the donkey by his teeth is a very imprecise science. Such a lot depends on the type of food he's been eating. In the young donkey, we will see the first pair of permanent incisors at about 2.5 to 3, the middle pair at 3.5 to 4, and the corner pair at 4.5 to 5. So far, so easy. We then look at the appearance of the occlusal surface of the lower central incisors, which is a cross-section of the tooth as it erupts and wears. This diagram is of an incisor tooth split longitudinally, and you can see that it has an infolding of the enamel to make a blind-ended funnel starting from the top of the tooth, and we call this the infundibulum. But this only goes about a third of the way down the tooth, so if we can't see this on the occlusal surface, we know that about 1/3 of the tooth has already worn away. Another component of the tooth that's important in estimating age is the pulp cavity, and this starts from the bottom of the tooth. You can see that this starts to become apparent on the occlusal surface of the tooth when again about 1/3 has worn away, and it's called the dental star. So once we see this, we know that about 1/3 of the tooth has worn away. When you see both the infundibulum and the star, the donkey is very roughly 10. If the infundibulum is deep, then the tooth is not very worn. But as the tooth wears down, the infundibulum becomes shallower and gradually disappears, or just remains as the remnant of the enamel ring that lined the funnel. I've seen this enamel ring in a donkey that I know to be 20, so this donkey was not following the aging rules, and many donkeys don't. The pulp cavity or dental star starts to become visible as a brown line. The shape of the tooth changes with time too, from being broad from side to side, through to square, and then triangular as the donkey ages. There's a lot to take in this slide, so do have another look at your leisure. A simpler way, though not so accurate, is to take a look at the incisor furthest away from the midline. This is called the corner incisor, and you can see this really easily by lifting up the upper lip at the side of the mouth. If this corner tooth is broader than long, then the donkey is likely to be less than 10. Once the tooth is square in shape, because it's erupted a bit further, then the donkey is around 12-ish, and once the tooth is longer than broad, then the donkey is a teenager. And take a look at the angle of the incisors. With increasing age, the incisors tend to be angled further forward. A lot can go wrong in a donkey's mouth. Congenital disorders are seen where the upper and lower jaw are not of the same length, such as parrot mouth or sow mouth. In severe cases, the donkey will simply not be able to eat properly. The baby teeth can fail to fall out even when the permanent tooth is erupting. This happens to the donkey between 2.5 and 5 years of age and can cause problems with eating due to the pain. Some donkeys have impacted teeth that can't erupt properly or may become displaced. This is particularly common in mini donks whose heads simply aren't big enough to house the 6 large cheek teeth. Now, donkeys cope well with the loss of one or more incisors, but the loss of a molar is serious, as we'll come on to. A tooth root infection can result in sinusitis. Remember, those roots are lying within the sinuses. Any donkey with a one-sided smelly nasal discharge should be seen by the vet quickly, as this is a sure sign of dental disease affecting the sinuses. Should a donkey get kicked in the face, the result could be fractured teeth, particularly those incisors. The donkey's cheek teeth should work as a single grinding unit, and this can go badly wrong if there are gaps between the teeth, which we call diastema. Food can get stuck in the gaps, and the donkey has no way of removing it himself. Food packing like this will lead to gum disease, known as periodontal disease, which is very painful and leads to a loosening of the tooth, which is also painful as there are thousands of nerve fibers in the tissue that binds the tooth to the jawbone. The tooth could eventually fall out. Now, just as a donkey's best friend is another donkey, a donkey tooth's best friend is its opposing tooth. If the opposing tooth is not present, there's nothing to stop the other tooth erupting without wear, and this can compromise the whole chewing cycle. And because all the tissues that make up the tooth are harder than bone, In severe cases, the overgrown tooth can start to penetrate the opposite jawbone as it impacts on it every time the donkey chews. And how many times a day do they chew? You'll remember I asked this question at the beginning. Would you believe around 50,000 times? So that would be 50,000 episodes of pain every day. Similarly, sharp enamel points can lacerate the tongue and cheek tissues, extremely painful. And there are some people out there performing catastrophically bad work in the mouths of donkeys. We've seen a catalogue of things that can go wrong, mostly very painful conditions and things that the donkey can do nothing about himself. I've listed some signs of dental disease, but probably the most common sign of dental disease is actually nothing at all. The stoic nature of the donkey means he could be in a lot of pain but not show obvious signs. In a loving home with plentiful food, they don't even lose weight. They may even be fat. Your donkey's breath should be kissably sweet, so any bad breath is a bad sign. What you can do is check the poo for any long fibres, which indicate that the donkey is not grinding his forage down as he should. If you see a lot of fibres longer than about 3 millimeters, that points to a potential problem. However observant you are, you can't see a problem with the cheek teeth because you can't look that far into the mouth. This is the reason that it's absolutely essential that you have your donkey's teeth checked at least once a year by a qualified professional, a vet or an equine dental technician. That's an EDT. If you are using an EDT rather than a vet, do check that they're actually qualified. The industry is still largely unregulated, and there are people claiming to be equine dentists that have had no training but have simply purchased a set of tooth rasps. There are even farriers that make an extra buck by using the same rasp in the mouth as they do for the hooves. Would you go to a chiropodist if you had toothache? I don't think so. Untrained people can do untold and permanent damage. Untold because you can't see what they've done, and permanent because over-rasping or floating can expose the pulp cavity and thereby expose the tooth nerves, which could lead to long-term pain and death of the tooth. A qualified EDT will be on the register of their professional body, such as the British Association of Equine Dental Technicians. So have a look at the BAEDT website to help you choose a dental technician. EDTs can perform routine floating, but must refer more complex problems to a vet. And they can't prescribe or supply anaesthetics or painkillers, which your donkey may need for some dental procedures. A lot of vets have obtained extra specialist qualifications and are also qualified EDTs. Again, check on your vet practice website to see if they have a vet that has had extra training in equine dentistry. It's a science that has progressed massively in the last 20 years or so, and those that qualified more than 20 years ago will not have learned the art of dentistry at college. I know that because I'm of that era and have had to do a lot of extra training to learn more about teeth. Depending on the condition of the mouth, the donkey may need to have examinations more frequently than just once a year. Be guided by your dental professional. And for those of you that might not be familiar with quidding, here are some typical quids that you might see on the ground if your donkey is not able to chew his food properly. And here's a donkey with such severe dental issues that he couldn't even chew grass properly and was spitting out boluses of grass, which you can see in the picture on the right. This donkey had missing molars in every arcade and was slowly starving to death because his grinding mechanism was no longer functioning. These diagrams illustrate what the vet or dental technician can do in the way of treating dental disorders by floating the teeth, which is now usually done using motorized dental equipment, a very safe procedure. The sharp enamel points can be rasped away and the rows of teeth made as even as possible, a process called equilibration. In order to visualize the mouth, a full mouth speculum, or gag, is used to keep the mouth safely open. This causes no discomfort and allows the professional to look right to the back of the mouth. Remember, those back teeth are right up inside the head at the level of the eye, so impossible to visualize without proper equipment and light. The dental professional should never drag the tongue out to the side to keep the mouth open. This can break the little bones in the throat. The picture at the top right shows what a good view you can get with the use of the gag and light source. It's simply not possible to carry out a proper examination without the use of a gag, so be very suspicious of anyone who says they will dental your donkey without using one. Any sharp points can be seen and floated away. You can see the sharp points in the middle picture and those at the bottom. Gaps or diastema can be treated and can be hugely improved by regular treatments. This is an example of where your dental professional may need to visit as often as every 3 months. They're a common problem in donkeys and cause severe unremitting pain. Particularly common in the older donkey, as the teeth become smaller towards the root, so they take up less room, and there are therefore gaps between them. If only the donkey had followed the design of the elephant in just possessing a single tooth in each jaw, there would be a lot less work for dental professionals. Other pathology can be seen and a treatment plan formulated. I mentioned gaps between the teeth, and here's a picture of one on the left, absolutely packed with food, which the donkey cannot rectify, so it'll stay there and go rotten and cause painful gum inflammation, which you can see on the right, and this will lead to a loosening of the tooth. I've said there's not much you can do to check your donkey's teeth, but you can check the outer edge of the upper teeth for sharp points or for any gaps, as this owner is doing. If there are sharp points on the outer edge of the upper teeth, there are likely to be sharp points on the inner edge of the lower teeth. Of course, you can look at the incisors, but you can also assess the cheek muscle, which I've coloured in red. This should be so thick that you can't feel the jawbone beneath. After all, it's a very active muscle, with the donkey chewing 50,000 times a day. If you can feel right down onto bone, the chances are your donkey is not using the cheek teeth properly, and so the muscle has withered away through non-use. Something else you can check for is to look for a build-up of tartar on the teeth. Here's a picture of a large build-up of tartar, especially on the canine tooth. Your dental professional can remove this. So that's it, a very brief run-through of the anatomy of teeth and what can go wrong. Please remember, the donkey can't tell you what's wrong, and you can't find out yourself. The dental health of your donkey is entirely in your hands. Dental disease is the second most common disease of donkeys and horses after foot disease, and is only exacerbated by most companion donkeys not having access to the highly abrasive vegetation they were designed to eat. And before you ask, yes, dental disease can occur in the wild and will probably be the death of the donkey as he struggles to eat and becomes easy prey. With at least an annual checkup by a competent professional, you can literally make the difference between life and death. That's how important teeth are. Thanks for listening. If you've listened to my other talks, you'll know that I like to gauge the audience interest, and my camera is on this donkey, but I'm not sure if he's telling me he liked the talk or not. Anyway, I hope you found it interesting.